Well, thank you, Sanjay. Welcome to our broadcast. Our patient here has a spinal fusion, which you can see on the x-ray. Are you seeing the x-ray, Sanjay?
Yes, doctor.
Mm-hmm. He has screws and rods. Let's go ahead and go AP. We'll show you a front-back view. He fell out of a tree 40 feet in the air. Fractured his spine. Let's show the rest of the rods. Pretty bad. But he has developed a pseudoarthrosis and adjacent segment disease, both. Pseudoarthrosis at L3-L5 and adjacent segment disease at L4-5. Now, he's got three options. He can live with his back pain that he has, or he can have the Deuk laser disc repair. If successful, we're going to eliminate that pain without having to do open surgery. On the other hand, we could do open surgery and go in and take the screws and rods out that he already has in there and put more screws and rods. Now, me personally, I wouldn't want to have such a major surgery. I would want to have something far less invasive. And that's what our plan is, to provide him with a less invasive option. The Deuk laser disc repair is that less invasive option, but you could probably tell that I'm actually getting ready to operate on a level of the spine that is actually supposed to be fused, but it's not. And that's the L3-4. Now, why is the L3-4 not fused? It's a great question. Let me have the needle. The fact is the L3-4 is not fused because sometimes fusions just don't take. May not be anything the surgeon did or the patient did. It's just the nature of the beast. Fusions sometimes just don't take. We call that a pseudoarthrosis or failed fusion. And when you get a failed fusion, the surgeon's got to figure out with the patient what the best course of action is. Sometimes you just leave it alone. That's the best course of action. Other times, you want to go in there and try to fix it. In this case, it's clearly causing problems. But we'd like to fix it without having to do major surgery. Shot? And if we can do that, it would be ideal. All right, is he almost ready? Let's get that AP.
Hello, my friend. How are you? You doing okay? Can we ask you a few questions?
Perfect.
Keep your head still. Don't move. We're going to ask you some questions, all right? Open your eyes.
So we want to wake him up.
Okay. His eyes are open.
And how long have you had back pain?
Don't move your head. How long? What year? I'm sorry, I couldn't hear you.
Shot?
20 years.
20 years? 20 years?
Yes.
All right.
Yes.
You know who this is?
You know who's talking to you?
It's your surgeon, Dr. Deuk Machen. All right. I was just telling everybody about your problem, how you fell and you've had fusion and now you have horrible pain below your fusion. As a matter of fact, you can see his fusion scar. You guys may not be able to see it, but it starts right here and it runs down like that. You're doing great, my friend. Just hang in there. All right, so we've got two discs that I think are causing his pain. And if I can get rid of that pain with the laser, then you won't have to have more fusion done. Are you comfortable?
Are you comfy?
Any pain?
Are
You having any pain?
Any pain? No.
No.
All right. Good. We like it that way. How bad is that on a scale of 1 to 10? 10? Is that where you get your pain?
Yes.
All right. 10 out of 10 at L4-5. Concordant. Great. That's one of the bad discs.
It'll get better. He's just
We're going to fix that for you, okay? Look at the giant tear, Jordan. Show us the tear. Sanjay, go to the x-ray. Show the tear. Now, by the way,
Yes, doctor.
You guys see those rods and hooks? These are called Harrington rods. See the rod? And those are called hooks. That was the type of hardware we used to put in back in the 90s, 80s and 90s. And that's when he had his accident. My God, thank God we have better hardware now. That's old stuff. We never put that in anymore. It doesn't work that well. Are you better now?
Yep.
Yes.
Hold on, stay still with me now.
How bad is that on a scale of 1 to 10 right there?
10.
All right, my friend, we found 2 bad discs. We're going to fix them both. When you wake up, the pain will be gone. 10 out of 10 at 3/4 concordant. Great.
Good carry, my friend.
Good news. So we know those 2 discs that we're operating on are the cause of his back pain. Once again,
So,
his history is he fell out of a tree, broke his back, had a fusion. You used Harrington rods. This was back in the 90s. And 1990, as a matter of fact, I believe. He's had back pain now for 20 years. Suffering. Nobody's been able to fix it, and we figured out why he has back pain here at Deuk Spine, and we're going to fix it today. Isn't that wonderful? All right, Sanjay, show us just a quick video of why do these disc problems cause so much back pain. You're fine. All right, welcome back. We are now advancing this dilator from the side. You could see it going down. We are going to enter to the L4-5 foramen and disc. That's where his biggest herniation is. He's got a gigantic herniation here. Remember, he fell out of a tree, 40 feet, 1990, fractured his spine, had Harrington rods put in, had a fusion done. Now he's got problems below the fusion, very common issue. We're heading in. We're going to fix his disc, a big tear. He had 10 out of 10 pain right here, 10 over 10. That's when you scale of 1 to 10, 10 being the worst pain in your life. It's kind of like having your arm ripped off without anesthesia. I asked him, what's your pain? He said 10. That's how bad it was. You could see him arching his back, moaning. So we are fixing that painful disc for him. It's going to be a great day for this man. I feel really good about it. Any questions?
Yes, we have a question from Ali Cameroon on Facebook. He says,
She.
oh, I know it's not the same area, but could a person have both cervical nerve pinched and also have suprascapular nerve impingement in the back?
Sure.
come on, please. Thank you. Yeah, you got that. And the suckers are on?
Yes, they can. People can have lots of causes of pain. All right. let's show our video on how does the Deuk laser disc repair. You got better.
And I always felt better.
Yeah. All right, welcome back. You could see how the Deuk laser disc repair fixes annular tears, herniated discs to get rid of pain by getting rid of the source of inflammation. And that's what we're going to do right here for this patient. His back pain is coming from these two discs for sure, L3-4, L4-5. Where is this gentleman from?
Titusville, Florida.
You're kidding me.
He's our neighbor.
And local from Titusville, from Florida. Wow. Well, so earlier today we had two Canadians. We had a patient from Arizona, and now we have a local homegrown young man. All right, there's the tear right there. You guys see that?
Yes, we do.
Good job, Sanjay. I love the commentary. Thank you.
Thank you, doctor.
Thank you for answering. Any more questions from our audience, Sanjay?
Yes, we have a question from Yunyang Yu.
Does
How
everybody understand that?
how large is the tube compared to the disc height for both neck and lumbar?
Yeah, so this tube you're looking at right now, the inner diameter is around 5 millimeters. The outer diameter is 7 millimeters, quarter inch. For the cervical, the outer diameter is 4 millimeters. The inner diameter is around 2.5 millimeters. So the tubes are different, cervical and lumbar.
We have a question from Ali Cameroon on Facebook. Do you help with suprascapular nerve impingement, or is that a shoulder doctor?
No, I don't treat suprascapular nerve impingement. You got to go to a shoulder doctor, an orthopedic surgeon. We don't treat that at Deuk Spine. Great question.
We have a question from Pompano Mike on YouTube.
Hello, Pompano Mike. Nice of you to join us.
How long did it take you to perfect the Deuk Spine slide? In the beginning, did you ever have to abort it? That is, pull the dilator out and restart with the needle?
All right, I heard how long did it take you to perfect, and I heard Deuk Spine and that was it.
Deuk Spine slide.
Sight?
Slide.
Oh, the slide for cervical.
Take the dilator out
Oh, right. And did I ever have to take the dilator out and abort? No. Yeah, it was actually, I'll be honest with you, it's an interesting story. So, Pompano Mike is asking me about cervical Deuk laser disc repair. So what I do on the neck. And we actually did that surgery earlier today. before this one. And then we took a break because we had to do some surgeries in another room that we don't have the video camera in. So we're back again, for those of you wondering. But the first surgery was a cervical 5667. We did the Deuk spine slide to go from C67 to C56 with the dilator. And when I learned how to do endoscopic surgery on the neck, on the cervical spine, it was by the South Koreans, by Dr. Seng-Ho Lee, Dr. Gun Choi. They were the pioneers. This was 18 years ago that I learned, okay, from them directly. And I had to go overseas. So when they did their surgery, they did a single level, one disc only. That's all they would do. They never did two. All right, I'll be honest, I never really thought much about it at the time. I've always been a treat whatever needs to be treated for the patient and don't make them come back and have multiple surgeries kind of guy. So it was actually just kind of a, first time I did it was sort of a natural thing in the sense that I knew I had to fix two discs. I really didn't think about just fixing one because I know I wouldn't want to have two surgeries. I just want to get it all done. So it just kind of, I sort of just did it. Yeah, it saved an incision. I sort of just did it. I just kind of, I guess, it's one of those things where you kind of learn a new thing and you think you paid attention and learned everything, and then you kind of realize later on that maybe you didn't see all of it and that you just kind of do what comes natural. So for me, I just did what came natural, and I took the dilator out of the disc and I slid it along the ALL. But of course I thought about it at first and I said, you know, what am I going to do here? How am I going to get to that second disc? And the reason I did it that way is because if you go in and you do the first disc and then you take your dilator out, there could be a lot of swelling in the soft tissue, and that swelling would affect the displacement of the carotid sheath away from the esophagus and trachea, and then you could end up, you know, not having a good displacement of part, and then you could have trouble getting in for the second disc. You could end up hurting something. So for me, it was like, all right, now I'm here, I'm right in front of the spine. The natural thing to do is to slide the dilator tip along the ALL and avoid coming out to cause any kind of trauma or anything. That's the safest way to do it. So I just did it. And the first time I did it, of course I was scared, you know, very apprehensive, fearful, whatever you want to call it, nervous, but it went well. It just slid so easily. So I've been doing it for 17 years now, and I've never published it. I should publish it because I'm the first to do it, but there's so many things we're the first to do. We just don't publish because it just takes too much time to publish things, and I really need like a couple of months just to stop operating and stop running this company just to publish everything we've done. I don't even think a couple of months would be enough time, maybe a couple of years. But if I take a sabbatical for a couple of years, there's nobody else that will do these surgeries, so we'll go out of business. Anyway, I appreciate your thoughts and comments on the Deuk spine slide. All right, for those of you who don't know, the laser fiber is the glass thing. It's clear. You guys could see it right there at 12 o'clock. The blue around it is the plastic that goes around it, that insulates it, okay? And the plastic really doesn't do anything to keep the laser beam inside there, but the plastic is more just for, you know, supporting the glass tube so that it doesn't break so easy. Because, you know, glass can break pretty easily. So it's kind of like your phone, where you have a case around it, protective case. That's sort of what that is. And of course the laser energy comes from a machine, the laser machine, and I use a Homium YAG laser, That's the only laser I will ever use. It's the safest, best laser. Luis and I are on an adventure right now with Homium Yak lasers. We're getting a new laser from Ohio. Supposed to arrive next week. Yeah, we're going to have 3 lasers arriving next week. Yep. And more to come as we expand our operations. All right, almost done here. You can see there's a lot of scar tissue around the herniation. The good news is when I'm done with this disc, I think the pain is going to be gone permanently from it. So we were very fortunate to be able to get in here and fix this. He's sleeping nicely, huh, Dr. Berndes? I hear him snoring.
We have a question from Mad Moose 67 on
Okay.
YouTube.
Very nice. Thanks for asking.
How do you feel about decompression therapy for spinal stenosis at L4-L5?
How do I feel about decompression therapy for spinal stenosis at L4-5? It doesn't work. It doesn't work, folks. Spinal stenosis, this right here, what you're seeing, is what causes spinal stenosis. And the laser can barely get rid of it. The laser cuts through steel. What makes you think decompression therapy will work? It doesn't work. The reason why they do it is because it pays the bills for the doctor doing it. Okay? They need to make money, so they need to have people like you coming in paying for decompression therapy. It's that simple. It doesn't work. There's so many treatments out there that don't work. And we don't recommend treatments that don't work. Stenosis is narrowing, and it comes from hard things like this disc herniation right here. And the only way to get rid of these things is surgery. Okay? If you don't want to just believe what these doctors tell you that, oh yeah, physical therapy, shots, PRP, stem cells, decompression therapy, those things, yeah, they're wonderful, but they don't work for the stenosis. Okay? There's a lot of people offering treatments that don't work out there. We don't do that at Deuk Spine. We only offer treatments that really work, that are actually the best treatment for the patient. As most of you can tell, we are very busy. We're busy for a reason. Our treatments work. That's why people travel from around the world here. It's not just for my good looks. Or Luis's beard. Remember Nikki said she wants to be just like you? She wants.
The beard, yeah.
So people don't come here because we're whatever, anything other than we have good results. We have good results because we do the right treatments. We don't do nonsense treatments that don't work.
We have a question from Yin Yang Yu on YouTube.
Sure.
Is there any eventual loss of disc height with this procedure?
Is there any loss of disc height with this procedure? No. The reason is we're not removing any of the disc. What you're seeing here is not the disc. You're seeing the tear in the disc, in the wall. You're not seeing the disc. So it's because we're not removing the disc, we're not doing a discectomy, we're doing an annular debridement. We're actually cleaning the wall of the disc. That's like saying if I take my car to the car wash, are they going to take the paint off my car? No, they're not going to take the paint. They're just going to take the dirt that's sitting on the paint. That dirt's not part of your car. That dirt is on top of your paint. So we're not actually taking the disc out here. We're taking the herniation out. The herniation already left the disc. It's no longer part of the disc. So it's the disc parts that left the disc through the tear. If that makes sense. So it's really not part of the disc anymore. Just like the dirt is not part of your car or your paint.
We
All
have
right. Just a few seconds left, and then we're done with this one. We're going to go to the next one.
we have a question from Ali Cameroon on Facebook.
Yes.
Does that laser disperse the energy on all areas of the glass or just the tip?
I couldn't really hear the whole question, Sanjay. Maybe you could repeat it.
Okay. Does that laser disperse the energy on all areas of
I
the
see.
glass
Or
or
just the tip?
just the tip?
It's just the tip. The laser energy only comes out the very end of the fiber. It doesn't come out of the sides. All right, we're done with this one. We're going to move to the next one. I feel good. We cleaned it out nicely. Yeah, the laser energy shoots out the tip. It shoots out, but it only goes out half a millimeter, 0.5 millimeter, so a very short distance. That's why the laser is so accurate and precise, because it has a very, very short working range where it works. And I can see, I can actually control the laser up to 0.1 millimeter. That's a tenth of a millimeter. There is no other tool in surgery, nothing, that gives you 0.1 millimeter precision. No tool. This is the most precise tool in surgery. There's no robot, there's no radiation treatment, watch behind you. There's nothing that gives you 0.1 millimeter of precision and accuracy, except for the laser. There's a lot of surgeons out there that disparage the laser's use in spine surgery. That's because they don't know how to use the laser properly. And quite honestly, they're afraid of it. They're losing business to the laser surgery. So, you know,
Or it got a bad name because it was used in interventional pain management. It didn't work the way they were using
Yeah.
it, non-surgical.
it's kind of like when you go to school and there's a very gifted student and the other students are very jealous and they just call that student names.
I suffered from that.
Yeah.
Got bullied too.
Yeah, it's called bullying. And so these other surgeons are trying to bully the laser surgeons because they know what we're doing is special. And they can't do it. Num. But that's why we broadcast, so people can learn the truth. Show me their surgeries. They don't show their surgeries.
They just bully them with results.
Yeah. They don't show their surgeries because they're afraid to show you their surgeries. Nobody in their right mind would ever sign up for surgery if you could see what they were doing. That's why we're going to show you what they're doing on our new website. Shot? See how we're going right past the metal? Shot?
Yes, we do.
Let's do this, Jordan. Let's finish placing the dilator, and let's get an AP view at the end when we're done. Shot. So everyone can see kind of how we're coming at this from the side. Because it looks like we're going through the rods, but we're not. That's good, yeah. Take it out. Shot out already, huh? That's cool. All right, give me a quick AP so everyone can see sort of how we're going around the rod. We're going actually in front of the rod. See that? Pretty cool, huh?
Yes, Dr. Deuk.
All right. We got about 15 minutes. We'll be done.
We have a question from Ali Cameroon on Facebook.
Yes, I'll take it. Cut my radio out here.
Are those blood vessels bleeding from inside of the disc? I thought it had no blood supply.
Huh? Are those blood vessels bleeding from the disc? I couldn't hear the last part.
I thought it had no blood supply.
Right. Great question. Yeah, so the disc actually does have blood supply. The outer half of the annulus does. But most of the bleeding that you're seeing is coming from muscle. Muscles have lots of blood supply, and we're passing through the muscle. So sometimes you're going to have a vein that that gets torn. Kind of like shaving your legs. If you shave your legs, sometimes you nick your skin and, oh, wait, stop. Yeah. I got it. No, I got it. Let go. Move that blue towel. Unclip that. Don't touch it. No, don't put your hands on it. Go ahead. Keep it and pull it down off the mayo. Which way do you want me to go with it? It's going to go towards her, right? Towards her? No, don't touch. All right, you ready? All right. Very good. Great question. So there's the inside of the disc right here, the inner part of the annulus. There is no blood supply. You don't see any blood vessels. But as we pull backwards, we get towards the outer part of the annulus, and then you're going to see blood supply. So you're correct that most of the disc has no blood supply. However, the outer half of the annulus does. That's where the inflammation comes from, is the outer half of the annulus.
We have a question from Yin Yang Yu on YouTube.
Laser on. Is it secured properly? All right, sorry, go ahead.
The dilated tube seems to take up 80 to 95% of the disc height in a healthy disc.
Yeah.
Is that optimal?
So in a healthy disc, in a lumbar spine, the height will be around 2 centimeters, 20 millimeters. This tube is 7 millimeters tall. So it's still, and that depends on male versus female. Male discs, healthy male disc, 2 centimeters or 20 millimeters. This is 7. So a real healthy disc would really be about 3 times the height of what I have here. Of course, there's variability. Some people have taller discs, some people have shorter discs. And what was the last part of the question?
Is that optimal?
Is that optimal? Yes, it's optimal. That is the right, it is the right size. I've been using it 17 years, and it's perfect. It doesn't cause any damage to the disc, and it works very well. It allows me to see everything I need to see. All right. You can see the tear right here. This disc right here, which is actually at the bottom of his fusion, but it didn't fuse. This disc here is actually not normal, but you can actually see the tear right there. And you have some scarred up part of the herniation right there. or scarred up part of the disc, I should say. I'd say 8 minutes, doctor.
Okay.
This looks very different than the last disc. This disc has more substance. But look here at the blue stuff as I'm hitting it with the laser beam and it's transferring the energy. It's not definitely not a normal disc. See how it acts? That acts like a disc with lots of scar tissue. Doing all right?
Yeah. Just adjusting his ulnar nerve.
Yeah.
I just do a survey once in a while.
I think it's a great idea.
Check blood pressure.
Yeah, I love it. Yeah, we're almost done. All right, any other questions from the audience? Really good questions today.
We have a comment from Pompano Mike on YouTube.
All right, Pompano Mike,
I
let's
believe
hear it.
I believe your live streams are the only online resource for those in pain. You and your team are doing a great service to the people all over the world.
Thank you. That's the idea, Pompano Mike. We're trying to help people.
I got married in Pompano.
Dr. Berndes says he got married in Pompano Beach, right?
Yep.
That's what Dr. Berndes said. So I've been to Pompano. I know they have that exit off the highway, Pompano.
Right.
I always stopped at that exit when I was coming back from Miami.
Right. Lighthouse.
Oh, it's more down
I
south?
got married Lighthouse Point. Beautiful there. Has an old lighthouse.
But thank you for the sentiment. We appreciate it. I'm an educator, as I've said before. You may not have heard my little speech, but I've been trying to teach people ever since I was in, well, at least in college for sure. And even in high school, I was always teaching the soccer players on the men's soccer team. Because, you know, sometimes the athletes don't have as much time to study. And I like teaching my teammates when we were on the road for games. So my teaching started at a young age, helping others learn, and I carried it through the university. I taught physics at UC San Diego, not as an instructor, but as a tutor. And then I also taught some upper division biology and molecular biology, biochemistry, tutoring for other students. Went on to med school and I taught medical students neuroanatomy, neurophysiology, things like that. And then in residency, of course, teaching other residents below me, younger residents, and patients. And I've been doing a lot of teaching of patients over the years. A good doctor, I think, is a doctor who teaches their patients. You know? It's one thing to diagnose, it's another thing to teach, to educate. You got to educate your patients about their problems. So I got used to teaching people about their back problems, neck problems. I got used to talking to them about it, sharing their diagnosis, why it hurts, why they have problems, and then of course why we should fix it so they can get better quality of life. So I've been teaching for a long time and I enjoy it. Now I'm teaching med students again as a neurosurgery professor at UCF in Orlando School of Medicine, teaching there. So I enjoy it. I actually enjoy teaching my patients the most, more than teaching the med students, believe it or not. Med students are good, they're appreciative, but my patients actually know more than the med students when it comes to back problems. It's nice to have patients that know what they're talking about. You know what I mean? So you're not starting at ground zero. It's so hard when people know nothing and you're expected to teach them from ground up. That's too hard. I can't do that, 30 times a day. So the fact that my patients have some knowledge, as much knowledge as they can get, that's wonderful for me, because then we're going to end up in the same place when it comes to decision making. They're going to make the same choices I would make because they're knowledgeable. All right, we're just about done. We've got about 3 minutes left, Dr. Berndes. But we'll keep taking questions. I'll keep answering them. And at the end, I'll come and answer them face to face with you all. So feel free to ask more questions.
We have a question from Ali Cameroon on Facebook. Assuming patients have been off pain medication for days before surgery, are they provided anything while they wait in the line the day of the surgery to be comfortable?
Well, I think I heard the question. I think it was patients are supposed to be off their pain medication for some days before surgery, for the laser surgery here. The only pain medication patients should be off for this surgery is their anti-inflammatory medications like Motrin, ibuprofen, naproxen. If you want to stop your other medications, then you really should talk to your doctor who prescribed them and make sure they're okay with that. Some medications require tapering, but generally I tell my patients to keep taking their medication unless it's an anti-inflammatory. Keep taking it until after their surgery, till after they've recovered completely. The other medicine that we don't like here is marijuana. If you on marijuana, then that can affect your anesthesia tremendously. So we don't want you on marijuana. Alcohol is another one. If you're a heavy drinker, we want you to cut back. A lot of people use alcohol to treat their pain. But basically, we do give Tylenol and Robaxin. That's it. These surgeries do not require anything more powerful than that. We used to give narcotics like Percocet, oxycodone, Dilaudid, but patients never took it. So we stopped giving it. And now all we give is Robaxin, and I got 1 minute, Robaxin and Tylenol. And that's it. That's all they need. Hopefully that answers your question. But we do have a pain management specialist here, Dr. DeMola. And Dr. DeMola's an expert at prescribed pain medications. So if there's a need for anything, he can handle it. All right, we're pretty much done. So see the bleeding right there, if that's what you're talking about? That's not in the disc, that's outside the disc. That's actually in the epidural space where the nerves are, okay? And there's little veins in there and fat, you see that? And
Yes,
that's where you get some bleeding. And the reason you get that bleeding is from inflammation. Remember, this disc is full of inflammation. So, all done. Patient did very well. I'm really excited for him. I think he's going to do fantastic. I mean, 20 years of back pain, and I think it's going to be gone. Maybe we can do a testimonial with him tomorrow. We've just run out of time for testimonials these days because I've been so busy operating, and I don't get to do really testimonials anymore. We just do them once in a while. But he would be a nice one to get a testimonial because of his history of having the fusion. Guys, don't turn the suction off, please. Okay. Let me know when. We need it back on. Let's not do that until we're done. Yep, thank you. Nope, no problem. All right, any other questions from our audience? Let me show you this tube. You guys see the tube?
Yes, we do.
Here, it looks like a shake straw. I call it the McDonald's shake straw. It's really thin. The whole surgery's done with it.
Thank you.
I'll show you the incision as well. Just give me a second. I like to put pressure on the muscle. Just that way it minimizes the amount of bleeding if you get any into the muscle. Bleeding in the muscle is not a serious problem. It just causes pain. Go ahead and break everything down. You guys see the cut?
Yes, we do.
Yeah. Today's cut's a little bigger than normal because we had to come in at different angles with two different needles. You ready? All right, let's go ahead and show our audience one of our patients, and I'll come and answer questions. Good morning, I'm Dr. Deuk. I'm here with one of my patients and friends who I've known for years, and she has been suffering with back pain for, well, I'll let her tell you how long. And a week ago, she came and had the Deuk laser disc repair. She's here for a checkup, and I'll let her tell you how she's doing as well. So how long have you had your back pain for?
Started back in May last year, and I just couldn't get any relief from anyone. Finally, I asked you, and the rest is history. So this last week has been the best week of my life since May of 2022. So pain-free.
Excellent.
Yeah.
Now, I know it got bad last year, but did you have back pain on and off before that?
I did. I actually got thrown from a horse back in 2018 in Ireland, and that's what I think probably started it. I was having lower back pain, but never really did anything about it, just sort of lived with it.
Kind of modified your life, took
Yeah.
it easy, try to avoid things that aggravated the pain.
Exactly.
And now I know that you were suffering so badly before the surgery, and here you are with a smile on your face.
Oh yeah,
Yeah.
definitely.
Well, I'm so happy you're out of pain. You had the Deuk laser disc repair. You could actually see, we use a laser to clean the tear in the back of the disc where the pain comes from. The problem is most doctors don't know that's where the pain comes from, so they have no idea how to fix it. My years of doing endoscopic surgery taught me that that's exactly where the pain comes from. So it's a small little spot in the back of the disc. You fix that, the back pain goes away.
And it worked.
It's amazing.
It's like I told your wife, you're a miracle worker.
Oh, thank you very much. Is there anything you want to say to your fans out there?
I just highly recommend if you've had back pain in the past, don't live with it anymore. Call Dr. Deuk. He is the best.
Yeah, so many people's lives are just, quality of life is ruined by back pain.
It is, and not worth it. I'm ready to start traveling again, so.
Not too much too soon.
Not too soon, I know.
All right, very good, Jean. Great to see you.
Alrighty, thank you so much.
You're welcome.
I appreciate it.
Great to see you.
You too.
Good morning, I'm Dr. Deuk at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home, And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional because it is an emotional thing. All right, we cut that testimonial a little short because I wanted to get with you guys and get these questions answered for you. The surgery went better than I expected. I'm very happy about it. As you could see from the earlier x-ray pictures, this particular patient had fractured many of his spine. He's lucky he's not paralyzed, and he had those rods on both sides called Harrington rods with the hooks. Honestly, we stopped using that back in the 80s, 90s when we got what are called polyaxial pedicle screws. So you could see that's an old construct, an old way of doing fusions, long segment. Now we use rods, but we use things called pedicle screws, which are far better. You can see right here, this is an example of a pedicle screw. It actually screws into the bone rather than sitting on top of the bone like his did with little hooks that go around the lamina. These pedicle screws give much better purchase. And so we stopped using Harrington rods back in the 80s and 90s, but his fusion was done in the, I think 1990 was the year, so, you know, a long time ago. That said, he never fused the bottom level. That's the L3-4. And it's been just grinding on that disc for years, and he's got an annular tear, he's got a herniation, he had pain, it was 10 out of 10 there, and the disc below. So I was able to combine the physical exam with his CT scan and figure out here's where the pain's coming from, these two discs, and we just completed the surgery and it went very well. What questions do we have?
We have a question from Dune Star Design on YouTube.
Star Design?
Yes, Dune Star Design.
Dune Star Design.
If I have a big bone spur in my foramen along with the bulge that is causing intense pressure down my arm, how much can you remove?
Great question. So the question is, I've got a herniated disc with a bone spur in the foramen, in my neck, causing arm symptoms. How much can you remove? I can remove enough to get rid of your arm symptoms permanently. How's that for an answer? Yep, we've never had a patient where we did not get rid of the arm symptoms with this surgery in 17 years and 1,700 surgeries. So if we didn't, you'd be the first one.
The next question is on YouTube. Is it possible that you could accidentally hit a nerve during this procedure? If
Yep.
so, what are the biggest risks associated with this procedure?
Great questions from,
It's kind of blurred because
on YouTube, a question was, two questions. One, could you accidentally hit the nerve? Yes, absolutely. The nerve is just outside the metal tube. So I could accidentally hit the nerve in the beginning when I'm putting the needle in, and when I'm putting the dilator in, I could accidentally hit a nerve. I could accidentally hit a nerve, I suppose, throughout the surgery, but for the most part, the tube is protecting the nerves. The nerves are behind the tube. So I would something would have to go very wrong to hit the nerve. I have never hit a nerve during surgery. So in 26 years of being a neurosurgeon, I've never accidentally hit a nerve. That doesn't mean it can't happen. Of course it can happen, I agree. And I've seen some of my other neurosurgeons cut nerves accidentally. But I myself have never. In 26 years, probably 10,000 surgeries that I've done on probably 30,000 nerves. Never once have I ever cut a nerve or injured a nerve. Second question was, what's the worst thing that can happen in this surgery? You can die. The patient can die. I think that would be the worst thing, but you could be paralyzed, nerve damage, spinal fluid leak, infection, meningitis, blood clots. pneumothorax, heart attack, stroke, bleeding, fractures, infection, all these bad things can happen. The real question is, how often will it happen with this particular surgery? The answer, we already know the answer. It's less than 1 in 1,000 you're going to have a complication with our surgery. Of course, when you do surgery with other surgeons in other places, more invasive surgeries which you don't need, you're going to have a much higher complication rate. Could be 50%. The 50% complication rate is published. It's real. It happens with fusion surgeries and invasive surgeries like laminectomies, discectomies. So the complication rate is much higher with those surgeries.
The next question's from Pompano Mike on YouTube. Following up on Yin Yang's question about the 7 mm dilator, isn't the opening of the dilator actually larger than 7 mm because it's cut at an angle?
Yeah, interesting. So I think what Ying Ying is asking about is this diameter from here. If this is the tube, what is the width? It's 7 millimeters. But you're right, the opening is fenestrated, it's kind of cut at an angle, and the opening of that would be bigger. But when you look straight ahead, that opening is 7 millimeters, just 7 millimeters.
The next question's from Karen on Facebook.
What's going on there? Huh? Something's wrong?
Something's wrong with the history. That's how history is screenshots. We have a question from Karen on Facebook. If you already have a lumbar fusion, are you a candidate for the laser on the other levels?
Yes. Yeah. Karen, you are correct. This patient's a perfect example. If you have a lumbar fusion already, you can still get the Deuk laser disc repair or the Deuk plasma rhizotomy to fix your back pain. Folks, if you have back pain, if you know somebody with back pain, we can fix it here. Back pain used to be something that was uncurable, unfixable. Not anymore. We can do it at Deuk Spine. It's just that everybody has a little bit different cause or combination of causes. So I got to look at each person's back. I got to look at their MRI. Sometimes I need additional tests, but I can figure out what's wrong with your back virtually 99.9% of the time. And we can fix it 99% of the time.
The next question is from Ali Cameroon on Facebook. Do those soft tissues that are inflamed or bleeding end up having more pain, or are you basically cauterizing that source?
Yeah, so Ali, thanks for asking. The areas that are bleeding that you saw at the end when I was done cleaning the tear, it was kind of at 12 o'clock, those are blood vessels that feed the inflammation at the back of the disc. Once you remove the herniation out of there and you clean the tear, the annular tear, get rid of all the herniation, you are removing the source of inflammation. That's what we do with the laser. So at the end of the surgery, all those blood vessels will go back to normal.
The next question is from Pompano Mike on YouTube. For your cervical patients, you require them to wear a neck brace. Is there any brace you require for your lumbar patients?
Yes. So Pompano Mike, we have a back brace we recommend for our lumbar patients. It is called a TLSO or LSO. We provide it to our patients here, and they need to wear it for 6 weeks.
The next question is from Greg Abbott on Facebook.
Greg Abbott.
I have a piece of bone cutting into my sonic nerve on the right side, supposed be hanging on by a thread. I'm in Baltimore, and I have a battery second one. I'm in severe pain.
So we can help you, Sonic Mike, from Baltimore.
Greg Abbott.
Sorry, Greg Abbott. I apologize. We can help you, Mr. Abbott. We can get the pressure off the nerve and get your pain gone with this procedure. It will take us about 30 minutes, and we do it through a little cut on your back. My advice to you is send us your MRI, mri.deukspine.com. I do a free MRI review. I give you 10 minutes of my time. We go through a lot of patients when we do these, and I could usually make the diagnosis within a few minutes and tell you what's wrong, and then discuss the recommended treatment as well as answer questions, all within about 10 minutes.
We have the last question from Earth Body Official on YouTube.
Odd Body Official on YouTube, thanks for joining us.
If you hit or hurt a nerve during the procedure, does that heal?
So if you hit or hurt a nerve during the procedure, will it heal? That's a great question. Generally with peripheral nerve injuries, if the injury to the nerve is, say, a stabbing injury, the nerve will heal completely. If you cut the nerve and just slice through it completely, it will not heal. Okay? So if you crush the nerve, usually it will heal, but it takes time. Yeah, hopefully that answers the question.
And that's all the questions we had.
Yeah, so it depends on the type of injury to the nerve. And if you look up nerve injuries on Google, you'll see there are different types of nerve injuries. But crushes and pokes heal. Transection of the nerve, cutting through it, will not heal. All right, hope you enjoyed our broadcast this week. It's Thursday. We'll be back next week for more action. I don't know what we have on the schedule, but you can look at the calendar on our website. You can see what spine surgeries are coming up next week. Have a wonderful day and a great weekend. I hope everybody feels